Hi guys, welcome back to my YouTube channel Basic Knowledge. Today we are talking about bronchiectasis. Bronchiectasis is the permanent dilation of bronchi and bronchioles caused by destruction of smooth muscle and the supporting elastic tissue. It typically results from or is associated with chronic necrotizing infection. It is not a primary disorder as it always occurs secondary to persistent infection or obstruction caused by variety of conditions. Bronchiectasis gives rise to a characteristic symptom complex dominated by cough and expectoration of copious amount of purulent sputum. Diagnosis depend on an appropriate history and radiographic demonstration of bronchial dilation. The condition that most commonly predispose to bronchiectasis include bronchial obstruction. Common causes are tumor, foreign bodies, and impaction of mucus. In these conditions, bronchiectasis is localized to obstructed lung asthma. Obstructed lung sanguine bronchiectasis also may complicate atopic asthma and chronic bronchiectasis. The congenital are hereditary conditions. For example, a cystic fibrosis in which the widespread severe bronchiectasis results from obstruction caused by abnormally viscid mucus and secondary infection. Immunodeficiency state, particularly immunoglobulin deficiencies in which localized or diffused bronchiectasis often develop because of recurrent bacterial infection. And primary ciliary dyskinesia, also called immotile cilia syndrome. This is a rare autosomal recessive disorder that is frequently associated with bronchiectasis and with sterility in male. It is caused by inherited abnormalities of cilia that impair muco inherited abnormalities of cilia that impair mucociliary clearance of airways leading to persistent infections. Necrotizing or suppurative pneumonia, particularly with virulent organization or vir- particularly with virulent organisms such as Staphylococcus aureus and Klebsiella spp predispose affect patient to development of bronchiectasis. Post-tuberculosis bronchiectasis continue to be a significant cause of morbidity in endemic areas. Two intertwined processes contribute to bronchiectasis include obstruction and chronic infection. Either may be the indicator, for example, obstruction caused by a foreign body impair the clearance of secretions, providing a favorable state for superimposed infection. The resultant inflammatory damage to the bronchial wall and accumulating exudate for further distend the airway, leading to irreversible dilation. Conversely, a persistent necrotizing infection in the bronchi or bronchioles may lead to poor clearance of the secretion, obstruction, and inflammation with peribronchial fibrosis and traction on bronchi. culminating again in full blown bronchiectasis. Thank you so much, guys, for watching, and must subscribe my YouTube channel Basic Knowledge. Keep watching, keep sporting.